Sexual headache. Recognize the symptoms, causes, prevention and treatment of sexual headaches. Sexual headaches are caused by sexual activity, especially orgasm. You may notice a dull ache in your head and neck that increases with increased sexual arousal, or you may usually experience a sudden, severe headache just before or during orgasm. Most sexual headaches are not a concern, but some of them can be a sign of a serious complication, such as problems with the blood vessels that feed your brain. Symptoms of sexual headache. There are two types of sexual headaches. A vague pain in the head and neck that is exacerbated by increased sexual arousal, sudden, severe, throbbing headache that occurs just before or at the time of orgasm. Sometimes in some people, both types of headaches are combined. Most sexual headaches last at least a few minutes. Others may take hours or even 2 to 3 days. Many people who experience sexual headaches experience them in clusters for a few months and then may continue for a year or more without any sexual headaches. More than half of people with sexual headaches experience it in about 6 months. Some people may have only one attack in their lifetime. Time to see a doctor. Sexual headaches are usually not a concern. But if you get a headache while having sex, talk to your doctor right away, especially if it starts suddenly or is your first headache of its kind. Causes of sexual headaches. Any sexual activity that leads to orgasm can cause sexual headaches. Sudden and rapid sexual headaches can be primary headache disorders that are not associated with any underlying disease. Sudden sexual headaches are most often associated with flattening of the artery wall inside the head or creating a bubble in it, intracranial aneurysm. Abnormal communication between arteries and veins of the brain, venous artery abnormalities, that bleed in a space full of spinal fluid in and around the brain, bleeding to the wall of the artery leading to the brain, autopsy, stroke, coronary artery disease, use of some medications such as birth control pills, inflammation caused by certain infections, sexual headaches associated with loss of consciousness, vomiting, stiff neck, other neurological symptoms, and severe pain lasting more than 24 hours are likely to have an underlying cause. Risk factors. Sexual headaches can affect everyone. But the risk factors for these headaches are: being a man. Men are more prone to sexual headaches. History of migraine. Susceptibility to migraines increases the risk of sexual headaches. Prevent sexual headaches. Sometimes sexual headaches can be prevented by stopping sexual activity before orgasm. It may also be helpful to play a passive role during sex. Diagnosis. Brain imaging. Your doctor will most likely order a brain imaging. Magnetic resonance imaging, MRI imaging of the brain can help identify the underlying causes of headaches. MRI scans use magnetic fields and radio waves to create cross-sectional images of structures inside the brain. Computed tomography, CT, in some cases, especially if your headache occurred less than 48 to 72 hours ago, a brain CT scan may be done. CT imaging uses an X-ray unit that rotates around your body and a computer to create cross-sectional images of your brain and head. Magnetic resonance angiography, MRA, and computed tomography, CT angiography. These tests visualize the blood vessels leading to and inside your brain and neck. Angiogram. In addition, your doctor may order cerebral angiography. This test can show the arteries of the neck and brain. The angiogram involves passing a thin, flexible tube through a blood vessel, which usually starts in the groin and reaches an artery in your neck. Contrast agents are injected into the tube so that the X-ray machine can create an image of the arteries in your neck and brain. Spinal cord injury. Sometimes a spinal cord injury, lumbar puncture, is also necessary, especially if the headache is sudden and has just started and brain imaging is normal. With this procedure, the doctor removes a small amount of fluid around the brain and spinal cord. A fluid sample may indicate bleeding or infection. Treatment of sexual headaches. In some cases, your first sexual headache may be your only headache. Some sexual headaches go away quickly, so the pain goes away before any painkillers can work. Sexual headache prevention drugs. If you have a history of sexual headaches and there is no underlying cause, your doctor may recommend that you take preventative medication regularly. These medications may include the following. Daily medications. For example, beta blockers, propranolol, Inderal, Inopran XL, or metoprolol, Lipressor, Toprol XL, which are used to treat high blood pressure, coronary heart disease and migraines, may be taken daily to prevent sexual headaches. These medications are only recommended if you have frequent or prolonged attacks. Occasional medications. Indomethacin, Indocin, Tivorbex, an anti-inflammatory drug or one of the triptans, is a class of migraine medications that can be taken 1 hour before sex to prevent headaches. Preparing for a visit and examination, you will most likely start treatment with a family doctor or GP. However, you may be referred to a neurologist. Here is some information to help you prepare for your doctor's appointment and know what to expect from your doctor. Making a list of questions can help you make the most of your time with your doctor. Here are some questions to ask your doctor about sexual activity-related headaches. What is most likely to cause my symptoms or illness? Are there other possible causes for my symptoms or condition? What tests do I need? Is my condition likely to be temporary or chronic? What is the best course of action? What is the alternative to the original method you suggest? I have other diseases. How can I best manage them together? Are there any restrictions I have to follow? Do I need to see a specialist? Is there a general alternative to the medication you are prescribing? Are there any brochures or other printed materials that I can get? What websites do you recommend? What should you expect from your doctor? Your doctor will likely ask you questions. So, prepare yourself to answer these questions. When did you first have a sexual headache? How fast did your headache start? When did orgasm headaches start? Have your headaches been persistent or intermittent? Were there any symptoms other than pain? Have you had other types of headaches? If so, how are they? Has anyone in your immediate family experienced migraines or sexual activity-related headaches? What seems to improve your headache? Does your headache get worse?